Lead us from untruth to truth, from darkness to light, from death to immortality, to peace, peace, peace.
Hello, viewers. I'm Chitra Krishnamurthy, the director of Nrityalaya, the School of Indian Classical Odissi Dance in Potomac, Maryland. We hope you liked our presentation of HERstory, a dance portraying a woman's battle to overcome darkness by rekindling her passion for dance. In spite of the delays due to COVID-19, we have persisted and produced HERstory. You can still view it. To shed more light on the topic of depression, we are conducting a post-production webinar. To moderate today's webinar, I will now call upon one of my senior dancers and teaching assistant, Dr. Kosha Shah.
Thank you, and hello, viewers. I'm Kosha Shah, and I've been associated with Nrityalaya for the past 25 years. Welcome to the Nrityalaya webinar series, Pursuing Passions to Heal, titled HERstory and OURstories, presenting the fourth post-production webinar. We have assembled an esteemed group of panelists. The panelists include speakers who have openly talked about the malady called depression that has challenged them. The panelists also include therapists, healthcare professionals who will give us further insight, as well as advocates who will go further into this darkness and the healing and recovery process. The very same panelists who took part in the pre-HERstory production webinars will now talk about their different paths to healing in the post-HERstory webinars. I'm convinced that with the different kinds of help available these days, and with modern technological innovations, there is great hope for the future. Let's start our conversation with the panelists in the fourth webinar of this series. We will conduct the Q&A discussion as a Q&A session. We are honored to have such a diverse panel today. Our speakers for today are Miss Yurei Moon, Miss Saveena Suri, our healthcare professionals for today are Dr. Antwi Lee and Dr. Janice Bray. In addition, we're honored to have a guest panelist, Miss Emily Rosado, an advocate for providing mental health care to low-income residents. Please give a warm welcome to our panelists. I would like to start off this panel discussion with a few questions for our speakers. Ms. Moon, please start by briefly describing your experiences with depression and tell us how you coped with it. This will serve as a refresher for our viewers. Over to you, Ms. Moon.
Sure. As I shared earlier, I struggled with depression and anxiety all throughout my life, starting as a young child, most likely due to traumatic experiences that I endured repeatedly as a child and then as a young adult. I shared earlier that I had a professor who sort of identified these symptoms and launched my journey to finding care and to start healing. And that was my first introduction, but I didn't really deeply go into the proper intensive care that I think I needed many years prior until my young adulthood. And this is because I was in a relationship with someone who is narcissistic, and the relationship triggered very intense panic attacks. And I had never experienced that symptom before, but was highly alarmed when that happened. And originally could not associate the panic attacks being triggered with this person I was in a relationship with, because I simply did not understand the correlation. And so I'm really thankful that I have an acquaintance who is a therapist, and I asked her for a referral. And because she knows me very well and understood the experience that I was undergoing at the time, and she knows my personality and sort of the needs that I had, she was able to refer me to someone who was a fantastic fit. And I am so proud to say that I've been working with the same individual for 12 years now. I've varied from seeing her once a week to seeing her now every 2 weeks. But she is such an instrumental piece of my healing journey. And we talk about all the time now how far I've come. Not only in terms of being able to manage my symptoms, but also growing and developing as a person, somebody that I'm really, really proud of being. And she has impacted every area of my life, not only health-wise, but also in terms of my relationships, in terms of my career, in terms of my parenting. She's been such a gift. And so I cannot recommend seeking out therapy, whether it's regularly or just sort of for a spot checkup here and there. I do think that it's appropriate for everybody.
Ms. Moon, you sound like such a resilient person. And I'm so glad that you brought up the point that you found a therapist that was a good fit for you. You found a healthcare professional that was a good fit, because it often, not often, but it can take some time to find that person that you can connect with. And the relationship is so important for fostering trust and the healing process. Thank you. And have you sought help for your depression? Well, I guess you did. And what other help did it look like? And if not, what barriers have you faced to seeking help?
So yes, in addition to therapy, I also have been on, variety, combination of medications, just depending on where I am in my life. I'm very closely monitored, not only by my therapist, but also, every once in a while I check in with a psychiatrist I trust very, very much. And my primary care physician is wonderful. And so I really have a wonderful team of healthcare providers. And I think that is so critical for getting the best care, because I do have somebody who's looking at me more holistically in terms of what's happening within my physical body, as well as how my mental health is manifesting, and then others who are focusing simply on my mental health, and also the way that the medication is impacting my body, not only my brain. And so in addition to medication, and that looks like a variety of things depending on the season of my life, I also take advantage of light therapy. I have seasonal affective disorder, so especially in the winter months, I have a light box that I have on in the mornings. The colleagues that I trust, when we're not in a pandemic and we're working in person, the colleagues that I trust know what my light box is for and encourage me to turn it on. I try to exercise and eat right and do all those things, which of course are really, really difficult routines to maintain when you're struggling with mental health. But after so many years of going on this journey, I do have a clear understanding of the correlation, very direct correlation between being outside, at least for me in my healing journey. I understand that being outside, being with nature, being under the sun, particular activities with my children, maintaining specific relationships and letting go of other relationships, those are all tools and resources that I have learned about and have applied over the years. And in terms of barriers to my healing journey, sometimes that can present itself as, self-sabotage sometimes can get in the way, and get me sort of off track. But overall, I think the arc is bending towards tremendous healing. And I think that's important for everybody to keep in mind, that the journey is not linear. is not linear. It is not, we don't simply go from broken to healed and it's this straight line. There are ups and downs, and there are a lot of veering off of the path and coming back on. And I think it's important to have grace with yourself if you're struggling with mental health.
That is so important, to have grace with yourself, to give yourself grace, to be patient. Thank you so much. I'll now ask Ms. Suri the very same questions. Ms. Suri, please briefly start by describing your experiences with depression and tell us how you coped with it. This will serve as a refresher for the viewers.
Yeah, hi. Just a refresher about me. I started experiencing symptoms of depression as a pretty young teen, but didn't really know exactly what was going on, and sought some professional care as a teen in high school, but didn't really believe in myself that there was a real problem, and thought, maybe there was just something wrong with me, and I was just wanted an excuse, and I got that messaging from my family, despite them really wanting for me to get better, because they noticed something was wrong. And so going through college was actually a really tough experience, when looking back at it, despite from the exterior seemingly functioning very normally. And it wasn't until I sort of pushed myself a little bit and kind of had to lie to myself a little, to say that what I'm feeling is not normal and that I need to get some help, and just think in those terms when getting that sort of help. And so at the end of college, I started seeking help again, and was in a much different mindset, was older, so was more independent from the feelings that my parents and my family sort of put upon me. I knew how to sort of go against it, still respecting, but still knowing I'm respecting them and whatnot. And so from there, I was really able to start a much more productive journey of healing.
Thank you. And did you have any other barriers that you faced for seeking help?
I would say, again, as Ms. Moon discussed, self-sabotage. I once had a therapist tell me that it sounded like I was gaslighting myself, which I sort of took a step back and was like, okay, maybe it's okay to let myself, be not okay, and that it's not really my fault. It's not that I'm not trying hard enough. It's unfortunately just like that sometimes. Big barrier for me. And again, it's tough. There are not many people who look like me, who have my experiences, that struggle, because again, we're all so unique. But until very recently, there wasn't much representation. And so just sort of still wrapping your head around that just because you don't look a certain way doesn't mean you don't have this issue. And so I would say those were definite barriers for me, and still sometimes are, towards really understanding that I should be kinder to myself, and that it's okay, that it's not because I'm not trying hard enough, and it's just sometimes it's okay that it's like that sometimes. So
I'm hearing similar themes from you and Miss Moon, that it's okay to give yourself some grace and be patient. Thank you for your touching stories and frank, inspiring comments. I will now turn to the healthcare professionals to get insight on help available for depression today. This question is for both Dr. Lee and Dr. Bray. What kind of help is available these days for depression? Please advise our viewers about what kinds of treatments are available. Over to you, Dr. Lee.
That is an excellent question. I really liked Ms. Moon's kind of clarification that there is a team that often kind of that team approach can be super helpful. So I can speak to kind of my portion of the team, which would be therapeutic help. And in terms of like specific treatments, kind of the frontline gold standard that we often use in psychology is what's called CBT, so cognitive behavioral therapy. When we think about mental health, right, kind of the approach I take is that it involves these 3 stages of the triangle, which is kind of our thoughts that maintain a lot of these depressive feelings, the feelings themselves and how we experience those, and then how that impacts our behavior. So kind of to give you an example, right? If I am feeling already kind of baseline depressed, maybe something happened, maybe not. And that's just like my typical mood, that can contribute, or that can feed into thoughts like, you know, I'm so worthless. Other people would be able to do these things. You have nothing to really be sad about. You should be able to get better, right? And so thinking those things probably going to keep me pretty low in that low mood, feeding into some of those feelings of hopelessness, potentially worthlessness, and that's going to affect our behavior. So if I'm thinking those things and I'm feeling that way, I'm much less likely to want to engage in the typical activities that I would do, right? I may not want to get up for work. I may not want to get up for school. I might not want to see people, even if I'm aware that those things help my mood. I may lack the motivation or the energy to be able to do those things. So in CBT work, what we would do is kind of target those different legs of the triangle. And that takes time. When we have been thinking those things and feeling that way for such a long time, it's going to take patience, which I think has been a theme that we've been talking about, to be able to rewire some of those thoughts, maybe to have a more balanced thought of, I'm really struggling right now, but I can give myself some grace and do some of these things that I know will be helpful to get myself to a space where maybe I can re-engage in some of those activities of daily life. And so, you know, they're small steps, but they add up over time. It really accumulates. So that's kind of the treatment that I really like to take. I also like a more holistic kind of approach. And so pulling in, you know, for people that are really connected to technology, for, you know, patients that I work with that are very tech savvy, there's a lot of different apps that people can use now to track your mood, to write down some of those thoughts that you're challenging, to meditate, to ground. So building some of those into the work that we do. There's CBT journals for folks that like to write and kind of keep a physical log of what they think and how they're feeling. And all of those pieces together really help. And for young kids, kind of the population that I work with, I think it's really important to pull in families. So again, building out that kind of supportive network, you know, having families check in on their children, developing systems within the family where we can communicate. Sometimes it can be really hard to verbalize how we're feeling. We may not have the words right away to describe everything that we're experiencing. So using color cards or face cards, especially for young kids, can be a really helpful way for parents to get a clue about what's going on, and for them to not make any assumptions and to be able to step in and support their children.
Thanks, Dr. Lee. Dr. Bray, over to you now.
Well, I think as we move forward and identifying what kinds of treatment and what kinds of options are available, I really appreciate Dr. Lee's introduction to the therapies. And I would like to, one, emphasize some tools that I have found recently were all inclusive, and hopefully we'll be able to get that to the audience. And it's through a website called mentalhealth.gov. I am a strong advocate for folks that have traumatic experiences, and I work currently with the VA. And there is a tool, mentalhealth.gov, that it talks about understanding depression, a resource for providers and patients. And I have found this is a very useful, all-inclusive tool that is not training people to be Google Docs, but actually has worksheets and has some factual information. The fonts are great. And so in thinking about that, the cognitive behavioral therapy, approach, there is another therapy that I thought was very useful in the context of what we do to soothe ourselves. And that is a part of that tool. And that's behavioral therapy, where it is with people that have depression and they isolate and they avoid social activities. It's a therapy that highlights your exposure to positive life events to reinforce social skills. And you can engage in physical activities that are enjoyable. Some people find it soothing to listen to music or to take music lessons. Dance and activating your body through movement actually generates a lot of the energy that we have lost when it comes to depression. So staying in my lane in terms of psychiatry, I did want to just kind of use a part of that tool to point out that prescription medicine sometimes is the best way to replenish your brain energy. And basically, with all the things that can happen, we lose energy because we fight our thoughts and struggle with the interface with reality. And one good example is gaslighting, when people tell you it's not that bad, or if you were just only strong enough, or it's not the worst thing that can happen. If you're struggling with low energy, it's difficult to incorporate that, and it causes confusion. It causes distress. We lose a lot of our brain energy worrying about who are we in the context of someone saying that we're just invalidated with our feelings of the reality of a situation. So my approach in terms of pharmacotherapy and looking at neurotransmitters is that there are things that can happen that cause us to lose energy. When we have to struggle with incorporating a traumatic event, we burn off a lot of energy to present ourselves in the way that we think society or family or friends want us to present. When you burn off more energy than you make, you're at a deficit. And then there sets in a cascade of events when you can't think, you can't concentrate, you can't sleep, you can't eat. And so part of the approach from the neurological perspective when it comes to things that impact these neurotransmitters is we try to replenish energy. And there are some tools and some studies and some validated medication therapies that actually go a long way in replenishing those neurotransmitters. And part of that is thinking about different classes of medications. Serotonin, norepinephrine, dopamine are all those neurotransmitters that you'll hear about. And so accessing either your primary care physician or accessing psychiatry, and it can give you a connection in order to expose your brain to things that can replenish that brain energy. Some people will be faced with the stigma of, well, you don't need a medication for that, or I don't believe in medications. But it's really not, it's not about the belief. It's about your physical, mental, behavioral, and social activities really rely on this brain energy. And so part of my role is, one, to educate, and also to identify those things that are going on with folks, whether it's depression or having been exposed to trauma, and whether it's genetic in terms of not being able to have a stable set of faculties and coping skills, that you are not able to function and enjoy life. And so that is where I think that people should really embrace the idea that you've decreased your brain energy, and it's not about a belief, it's about treatment as if you had cancer.
Thank you, Dr. Bray, for your overview on behavioral activation and the neurological perspective. This is very informative for our audience. Ms. Rosado, I'm sure you might come from a different perspective as you're involved in advocacy measures. Having listened to the speakers and the healthcare professionals who cope with depression with their clients and patients, could you talk about some of the struggles that underserved populations might face?
Sure. Thank you for that question. I think there are so many, starting with, stigma within our own communities and our own cultures. We touched on that earlier. And, you know, this idea that, you know, you should be strong enough to get over it and handle it on your own. This idea that if you see a therapist or if you take medication that, you know, you're crazy or, you know, there's something really wrong with you, you know, and just not treating mental illness as an actual health issue, right? Like any other health issue. You know, not everyone has access to care. And even for those who do have access to care, because of, you know, because of racism, we know that treatment is not equitable, right? And the way that certain minoritized groups are treated within that space of healthcare is not always good. You know, things like language difficulties, right? You know, people who don't speak English as a first language may have trouble communicating and may not have access to interpreters or family members to help them navigate those waters. And I think that, you know, Ms. Suri had referenced representation. I think that can be another barrier for people who may not necessarily feel comfortable seeking treatment, just not knowing, you know, not having someone who looks like them, you know, in that space of healthcare, I think can be a big obstacle. I know, you know, for myself, if I were to see a therapist, I would want to see someone who had a similar background to me, right? You know, either Asian or Latina. There's just a certain level of comfort and trust, I think, when you know that you have something in common with someone. So, and we know that in healthcare, there is a lack of representation. I do think that the needle is moving, though. I think that, you know, things are getting better, especially for my generation, well, and like my children's generation. You know, I think they're, you know, the amount of emphasis put on mental health issues is definitely going the right direction. And, you know, hopefully we'll continue to see more diversity among healthcare professionals and just less people feeling inhibited to talk about these issues.
Thank you, Ms. Rosado. From you three, I understand that help is available and it can be tailored for an individual. This is really good information for everybody to know. Our next set of questions are for the speakers, Ms. Moon and Ms. Suri. What empowers you and gives you hope to fight the battle? What message do you have for those suffering from depression but are afraid to seek help? What would you like our viewers to take away from our conversation today? Ms. Moon, your thoughts, please.
What empowers me is definitely what Professor Rosado was just mentioning about how things are going to be better for our children and their children. The resources are more available. Access is obviously inequitable, as Professor Rosado has been talking about, but getting better. And I think that young people now are having more open conversations amongst themselves about mental health. And that for me is very exciting. I know as a parent, I am so intent on breaking the cycles of, you know, what has happened in previous generations in my own family. I can very clearly see, based on my own personal interactions with my grandparents, as well as stories that I've heard, that there are certain people in my family in previous generations who did struggle with mental health. And I see that how that has been passed down. You know, it is my goal to not pass traumas down intergenerationally to my own children. That is a big motivator for me to heal myself. I have 2 small boys, and we do a lot of talking at home about feelings, about managing our feelings, about the fact that it is okay to have those big feelings and what we can do to cope with them. We talk a lot about strategies strategies. And I am so excited to see that their schools are also having these conversations. Socio-emotional learning is a big part of the curriculum in many school districts. My older son, when he was in preschool, started learning about zones of regulation and different colors and how they may represent different feelings. And he was coming home talking about zones of regulation, when he was just a toddler, and saying, sometimes I feel green, sometimes I feel red, and talking to me about what events in his life triggered those feelings. So I feel very excited by that. And also another thing that gives me a lot of hope too is just the mindfulness that instructors have at the higher ed level as well. I know Professor Rosado inspires me every day as a colleague and somebody who is so compassionate with her students. And that helps me become more aware of the tools that I can give to my own students, because oftentimes educators are, we're the first line of, we're the first responders in many, many situations. If a student feels safe in our classroom, they will approach us afterwards or during office hours and say, I am not feeling good, or I just had a panic attack. And so, knowing that educators are dealing with this more, especially during a pandemic, and we're learning how to, even if we're not especially trained, but we're learning how to at least receive our students and send them off to the appropriate resources like Dr. Lee and Dr. Bray. I think that also inspires me and gives me hope for the future, that as a society, we're generally becoming more informed.
Thank you, Ms. Moon, and thank you for serving as such a wonderful role model. Ms. Suri, now over to you.
Yeah, so I would say at a really small level, what keeps me, I think, going or wanting to keep going is just sort of remembering the feeling of lightness and ease I felt when things slowly started getting better, and how it was just really nice, and that it works, and I do feel better. And that is something that really grounds me sometimes if I'm, maybe doubting something. And again, things that Miss Moon discussed, just like the openness now is so much more, and it's so great. People my age, we talk about it so much, and it's discussed so much more commonly. And I think it's really awesome. And, especially like learning about how young kids they talk about their feelings, like hearing, I've heard younger kids, that makes me sad. Like, you hurt my feelings. And it's great that they're being taught to express difficult feelings, rather than sort of hiding them. And then just sort of, again, trying to stop intergenerational trauma, after hearing experiences of especially what women in my family have been through, just growing up in a different, in India, culture was really different and a little more repressive, and just knowing that they struggled so much and I don't have to, and I can make it better. And just for people, I just want people to know that if you think something's going on and you just don't feel that good, but you don't think maybe it's not what it is or whatever, there's no harm trying. There's no harm just seeing. Worst case, they'll say, you know what, actually, you should try X or Y. And I think it's just worth trying. And it's okay if nothing's wrong if you go. There's no, harm in just trying to see what's going on. So.
And I'll just echo something that you said earlier, that the new conversations that are happening kind of help people understand that you're not alone when we're having this dialogue, such as we're having today. So thank you for touching on that. Ms. Moon and Ms. Suri, your struggles and roads to recovery are moving experiences. And I want to thank you for that, for sharing this and being so vulnerable and open with our viewers. The next set of questions for Dr. Lee and for Dr. Bray Depression is not contagious in an infectious manner, yet it is hard to open up, even to loved ones. Most times, it seems hard to even broach the subject, much less offer advice to loved ones who you can see are depressed and are in need of help. What myths can you dispel for those that are seeking help? Does stigma delay the recognition and acknowledgement of depression and cause delays in treatment leading to horrific outcomes? What advice would you give to our viewers today? Dr. Bray, your thoughts, please.
Well, the stigma of depression, of mental illness, of seeking help is alive and well. It also interfaces with the perception of having not only a manifestation of low mood, low energy, questioning ourselves, as you impact an environment of people that will dismiss all of those feelings, it's very difficult. So when I, in our earlier discussion, talked about say something, it's really important to say something. And if it's not that first person in the house, do not go within, and to continue to say something about how you're feeling. Communication with those people that are around you is difficult. If you are feeling at the point of not wanting to live anymore, people will run away from you. And it is very important, however, to iterate that. Lots of times you'll say anything that has to do with self-harm and you're shuttled off to a hospital. So it is important to also engage in self-care. Some of the myths that people have is that, oh, depression is something that you'll get over. And you'll just get over it. You sleep, go have something to eat, and you'll be fine. And that is not true. Depression is something that is just a rare occurrence, and that you don't really need a doctor. You don't really need to go to the hospital. But it is 1 in 5 people in America will have an incidence of depression over a lifetime. There's 40% of people that have reported feeling depressed have experienced that at the age of 14. So that myth that children do not get depressed or do not have a clinical depression is something that also we need to dispel, and that mental illness is a sign of weakness. We've spoken about that in some of our earlier discussions. And so those absolutely decrease the amount of people that will go get the help that they need. But it is very serious to not get help because it can lead to death.
Yes, it is detrimental and lethal. And I'm glad that you've touched on these very important myths. And now, Dr. Lee, over to you.
So I think there are 2 kind of interconnected myths that I'd really like to talk about. The first one is, I alluded to it earlier, but this notion that something really tremendously horrible has had to happen in order for your depression to be warranted. I think a lot of people suffer from kind of guilt or self-blame when they feel like there isn't anything in their life to kind of attribute these feelings to. And so I think it's really important to just clarify, depression can be, again, due to a number of causes. It can be a chemical imbalance. It can be things that have happened in your life that are adverse events. It can be the interaction between those different things. And so the first piece to being able to receive help, I think, is for folks to really acknowledge that it's okay that they're feeling this way and that these feelings are real and that they're valid. There doesn't need to be kind of this identifiable reason that you can see with your eye or that you can verbalize for those feelings to be true. I think once people give themselves that permission, the kind of second step of that, connected to what Dr. Bray has been emphasizing, is when we allow ourselves to feel okay with those feelings, then it will be much easier for us to communicate and to talk about them. There isn't that shame associated with it. And that's kind of the second myth that I'd like to talk about, is this idea that if we talk about it, it will make it worse. This is true for individuals, adults that I've seen, and for families as well, right? When your child is endorsing something as severe as suicide or thoughts of self-harm, it's really scary. And it can cause people to want to turn away from that. Sometimes parents are really worried about broaching those topics because they don't want to put ideas in their kids' heads. And so I've never found that to be the case. I've always found that when we can be transparent and we can name things, that actually gives us back a lot of power, and it makes things feel a lot more manageable than if we're kind of just struggling on our own. And that's true of kids and of adults. So I think kind of the advice that I'd like to give to viewers is really kind of that acceptance piece first, and doing whatever you need to reach that point, and then communicating and connecting with trusted others to be able to establish the long-term care or the management that we need. I didn't really address that earlier, but I think one important point is going to be how to get connected to that care. I'm coming from Virginia, and so a lot of the places here, every county has what's called a community services board. It's a hub of mental health resources. And so if you don't know kind of where to get started, reaching out to them is a really important first step, because they can direct you, and they offer a lot of services. It can be counseling, it can be case management, it can be medication. And so kind of getting connected to that first piece, I think, is really critical.
Thank you, Dr. Lee. And so important that you also said that naming it or talking about it, sometimes people feel that it'll get worse. And I want to connect it with something Ms. Moon said earlier, that progress isn't linear. So if it does get worse, talk to your healthcare professionals, talk about it, and remember that it isn't linear, like Ms. Moon mentioned. It goes up and down. That's just like life. So I appreciate it. Ms. Rosado, what kind of resources can you provide to our viewers today?
Thank you. Yeah, so that's the good news, right? Is that there are resources to help people, even people who, can't afford traditional help. So things such as, the National Hotline, which is open 24/7. And I always like to emphasize to people that you don't have to be in a complete crisis to use the hotline. If you just need a supportive listener or someone to talk to, if you've had a really bad day, you can call the hotline, and there will be someone there to kind of help you process those feelings and talk you through those difficulties. Also, I know here in Montgomery County, we have local agencies, just like Dr. Lee mentioned. Specifically, we have the Asian American Health Initiative in Montgomery County, which provides services, not direct services, but has a lot of resources for people, including their Health Navigators program, which can help people who need translators to accompany them to appointments if language barriers are an issue. Like it was already mentioned, apps, there are so many different apps to help you, like with your breathing exercises or to help you meditate. So, and I think it's important for people to, if they need help, to pay attention to who's doing this work, who's having these conversations. It always helps to start with someone who you trust, who is who is invested in these issues. We always tell like little kids, if they're in trouble, like look for the helpers, right? So like look for the helpers, right? There's someone, you probably know someone who can put you on the right path and to point you towards resources, and who's just happy to listen and to be a resource for you.
Thank you to the three of you for informing our viewers that help is available and they should reach out. Thanks to all of the panelists, the speakers, Ms. Moon and Ms. Suri. We really appreciate your willingness to openly talk and share your touching stories of depression with us. A heartfelt thanks to the therapist, Dr. Lee, and psychiatrist, Dr. Bray, as well as our very own advocate, Ms. Rosado, for sharing the experiences they have and giving us information about the help that's available today. Viewers, the same panelists have assembled before and after the presentation of HERstory and talked about their varied journeys to healing and the help available. Listening to the panel, has been inspiring and filled us with hope. Although the path to healing and recovery is never easy, taking those first small steps seems to be the key. In the caption below, you'll find some websites and links where help is available. Folks, do not despair, as help is only a click away. Thank you, viewers, for joining us on this important conversation today.
These are indeed very important conversations. Viewers, you can view all the webinars as they are on YouTube. They include diverse panels that have presented different viewpoints. Please help us spread the word. We definitely welcome and encourage participation in our webinars. So if you're interested, please send an email to nrityalaya@hotmail.com with your name, telephone number, and email so we can contact you. Please put Nrityalaya Webinar Series in the subject line to alert us to your interest. We hope you liked our presentation of HERstory. We have been very excited to have you join us as we explore Her's journey through depression and her healing process. Thanks for your patience. The credit for the webinar series goes to the Nrityalaya webinar team. Please check our website at www.odysseynrityalaya.com for updates. This is Dr. Chitra Krishnamurthy signing off from the 4th episode of the Post-HERstory series, Pursuing Passions to Heal, HERstory and OURstories webinars. Thank you.